I'm Gail Miller. Welcome to my Aged Care Mythbuster series. Today we're busting aged care myth number 15, and it's that mum and dad's doctor won't talk to me. Technically that's correct. They're not allowed to talk to you because of our privacy policy rules. However, if with mum and dad's permission you set up a third party authority with the doctor, they can discuss anything with you. I actually went to visit my dad's doctor and my mother-in-law's doctor without them knowing, not to get information but to give the doctor information. Mum had some stuff that she wanted the doctor to know, but he kept inviting them in together. Mum didn't go to the doctors very often, but when she did, it seemed to synchronise with an appointment with Dad. And so she never got the opportunity to actually tell the doctor a few things that she thought he needed to know about Dad. So when I went to see him, I said, I don't expect to be bulk billed. This needs to be a regular consultation, but I've got some information that Mum wants you to know about Dad that we think's important. So I gave it to him and he said, now firstly, I'll be bulk billing you for this. You've got no idea how much easier you've just made it for me to care properly for your mum and dad by giving me this information. He said, I wish all kids would come and tell me about their parents. And he said also, as your parents get older, you need to do a role reversal so that you become the parent and they become the child. Obviously not in a childlike fashion, but it might be that you need to start helping them with decisions, helping them with stuff that's becoming too difficult. So he said, if you can do a role reversal, that would really be good. My sister and I had already done something with mum and dad. I relayed that to the doctor and he said, right, you've already done the role reversal. But he said a lot of families find this really difficult. So that's very important. With my mother-in-law, the family felt that there were things that the doctor may not know about her. So I actually typed out 1.5 A4 pages and I gave it to him. He sat there and read it and looked up at me and he said, I didn't know any of that. She presents so well that I wouldn't have had a clue that that's actually what's going on at home. So thank you so much for giving me this information. So there's two doctors that were really grateful for information. But in lots of cases, it's important to have this two-way dialogue. So if you can set up third-party authority, your parents will need to approve it, but help them to understand that you're not trying to take over, but that there might be things that you can help them with or simplify if you and the doctor can actually talk. So that's an important thing to do. Also, I don't believe that most parents are trying to deceive their families. I think they genuinely can't see their decline and that they're not managing some things. So stepping in and setting up third-party authority with the doctor, with any of the utilities that need to be paid on time, any places that they're connected with can really be very helpful. And if you can do it before the wheels fall off, that's going to be very beneficial. Stay tuned and we'll bust aged care myth number 16 very shortly.